we hear that the overall number of deaths has gone down a little bit across the province, yet it's still close to 2,000 people. So what do you make of that?
Yeah, so the number of deaths in 2024 has seen a small decline compared to the previous year, but still in the interior health region, almost 400 people died due to the toxic drug supply in 2024. So that is still a very high number. It's 3 times the number that we were seeing before the pandemic. So while this is an early indication, the decline is promising, and it's an early indication that hopefully it will hold and continue to decline, we are still very concerned about every one of these deaths.
Still, I understand the vast majority of the deaths are fentanyl.
Yes, the vast majority, most of the deaths are due to fentanyl. There is, however, combination of fentanyl with other drugs, and one that is coming up is benzodiazepines. Benzodiazepines are a class of medications that are also depressants. When they are combined with fentanyl, they will further decrease your breathing and create a very toxic situation for the person.
Making it even more deadly.
Making it even more deadly, exactly.
So of this list of strategies, what strikes you as elements that you really see working?
Well, from awareness. Awareness is the one thing that is a really important strategy for individuals to know what services are available and to be able to speak about their needs with other people and with a provider, with somebody from interior health, a clinician, or with their family doctor. The first step is to seek help, to talk to somebody. And that can be for treatment, somebody who is willing to go into treatment, but also for somebody who is actively using and can speak to somebody and seek that buddy system, somebody who can watch over them in case they have an overdose.
Well, we hear so much about there being a lack of beds available for treatment, but if there's somebody who tomorrow says, my fentanyl problem is going to kill me, I need help, is there somewhere where they can at least talk to someone right now?
Yes, there is a new initiative that we have through Interior Health. It's called the Virtual Addiction Medicine, VAM, and individuals can look for that in our website. And it's a self-referred program. People can enter their information in there, and they can have access within a day to a clinician, to somebody to talk to them. And it's not only for substance use, but it's also for alcohol. So there is also medications to help with alcohol use disorder, individuals who want to reduce their drinking or stop drinking, and this service can help them achieve, access a clinician. So that's one option. We have other treatment options. Individuals can, be seen at the emergency department. There is the 311 MHSU number that people can call. So there is multiple doors to get into the system of care for treatment. And that is very important that people are aware that there is options for treatment. Not everybody will need a bed. There are options for treatment that are based on pharmacotherapy, so prescribe them treatment and not needing a detox or an admission into a facility. So very important that people are aware that there are services through Interior Health that are available to them.
Right. Are there ideas that have been tried and just don't work?
Well, I think that there is different services that work for different people. So individuals looking for options, there is options for them. And if they try one and it doesn't work for them, there is other options that they can try. So and as I said, treatment is, the treatment journey includes relapse. So sometimes individuals have to try more than one time to get into treatment to achieve their goals. Right. So this is all about treatment. It's important that we also talk about harm reduction, which is another alternative for individuals that are actively using substances. And the harm reduction, which is also offered through Interior Health. In fact, we've distributed almost 90,000 naloxone kits. You may have seen those naloxone kits. We have distributed so many of those, tens of thousands of drug checking services offered. So naloxone, which is very important for people to have and to be able to know how to use. People need to be trained on how to use it. Drug checking. We also offer in some communities supervised consumption or overdose prevention, and that is for individuals who are seeking an environment where they can be supported should they overdose. So those are some of the services that we offer through Interior Health that have been effective. We know because we speak with clients, we speak with providers, and those services have been effective. However, we need to, as you say, this is ongoing, and there is a need to, do more. And we are working towards a number of strategies to improve and reach to more individuals.
We do see naloxone kits now all over the place, and that's got to be saving some lives. Just the fact that there's more often one handy.
Yes. We know we don't collect information on how those are being used, but we know that those are being used in the community. It's very important that we talk about prevention of substance use to begin with, and is a very important component, and that's something that we are working towards, working with youth, working with schools to advance a program that is aimed at preventing substance use and alcohol use among youth. So we work on that. And also very important, the work on stigma, right? To make the system welcome, allow individuals who use substances to come in and disclose their use. That's so that they can get the help that they need.
So minor decline in the number of deaths. Are you optimistic that in the future we're going to see a more dramatic decline in fatalities related to this?
I'm cautiously optimistic. Yes, I believe that this trend towards the downwards can hold. We have seen that before. In 2019, before the pandemic, there was a steep decline in the number of deaths. We were doing it. We were coming back the other end. However, during the pandemic, there were a number of issues that occurred, and we can't pinpoint to one specific reason, but that's when we saw deaths go up again. So I'm cautiously optimistic. The message that I would like to give people in the interior region is to find services that they need. Interior Health offers a number of services. We work from prevention, treatment, harm reduction. Get familiar with our website, call the 311 MHSU number, explore the virtual addiction medicine option. There is a number of places where we offer drug checking and naloxone, and there is a website, it's called Toward the Heart, where you can find a provider in your community where is their harm reduction. Grab a kit, watch a video on how to use it, talk to your friends, talk to your kids, any questions that they may have a conversation, and let's talk about it, because that's the first step towards helping each other.
Terrific. I hope this is part of that. Thanks.
Excellent. Thank you.
We don't just report the news. We live here too. We're your neighbors, bringing you stories that matter to all of us. No government funding, no outside influence. Kelowna Now, local, independent. News you can trust.